Hello and welcome to our first event tonight at 6 p.m. UK time. So it is time for our online patient meeting. I hope you are well and ready to find out a bit more on our today's topic. But before that, let me just simply mention that we are here every single day so that you can find out a bit more on various topics on fertility, and you can also make top fertility experts, but other people that are supporting our Stronger Together initiative as well. And of course, today there is another special guest that we have invited, and this is Rob Milnes. Hi, Rob. How are you feeling? Please let me know that you can hear me as well.
Yep, I can hear you.
Excellent. Thank you so much for confirming that. And of course, just let me also remind you that all of our events have been brought to you thanks to our ambassadors and partners. As you know, nothing would be possible without them. So as always, I definitely want to thank them for their constant support. And some of them have been already our presenters. Some of them will have a chance. And also I would like to mention that actually Rob is also one of our partner and ambassadors. So you can see him right here. So thank you, Rob, already for supporting our initiative. It's a pleasure to have you on board with us, for sure.
Yeah, pleasure.
And today, of course, Rob will start with his short introduction, and afterwards he will answer the most common questions. And of course, right after that, this will be time for your questions. So all you will need to do is just type in the questions in the chat section so that Rob can help you out a bit with any of your questions. And of course, remember, it is going to be recorded, therefore you will have a chance to watch this again. And well, that is it from me at this point. Rob, are you ready to begin with your presentation and of course your introduction?
Sure. Well, thank you very much to my IVS Answers for having us and allowing us the opportunity to present. So I'm going to give a brief introduction just so that everybody understands the basis for the discussion. So I'm the CEO of a company called Fertility Focus, and we market a product called OvuSense, and we're just about to launch a product which will help clinicians and the users of OvuSense to interact, called OvuSense Pro. So I'm just going to introduce the basic product itself and then go on to discuss what Pro will do for our users. This product was developed, first of all, in Bristol University by some veterinary scientists who decided that they wanted to try and check rapid temperature rises, and it was in cattle at the time that they were trying to do this. But at the time, they then realized that there was an application for the technology in humans for determining when a lady ovulates and if she's going to ovulate. And that's essentially what we used as the basis for developing the OvuSense product. It went through a clinical trial in 2012, and it's been on the market in the UK and now US since 2014-15. And then in 2016, we launched an app version of the product. So the product that you see on the left of your screen here is essentially the current product that we sell, which comprises a sensor. It's placed in the vagina overnight. It takes readings of core body temperature every 5 minutes. It's taken out in the morning, and then you download your data from the sensor to the OvuSense app, which can operate on Apple and Android phones. And so we've been gathering lots of clinical data since the start of OvuSense. And with that clinical data, we saw that we could perhaps enhance the experience of OvuSense, particularly for clinicians, to understand more about what was going on in cycles. So OvuSense itself will predict the onset of ovulation up to 24 hours in advance using the current cycle data. And it will detect the exact date of ovulation, and it gives messages for both of those things. But what we also noticed is that women that have issues with conceiving tend to have variability in that cycle pattern. And in fact, you can see on the cycle pattern on the right, that's a good example of one of those variable, or as we call them, atypical patterns. And what we went about doing was developing a product that can be used by clinicians, but also seen by the users themselves, that gives you an idea of these particular patterns. So I've basically talked a little bit already about the existing OvuSense product. just one other thing to say about that. Largely, when we started, it was targeted at women who have polycystic ovarian syndrome or various issues with conception. We normally said any woman that has been trying to conceive for 6 months really should start to look at reasons why they may be struggling to conceive, and OvuSense was targeted at them. Much more now, it's used by all women throughout their attempts to conceive, even those that have not even started to actively try yet. And really what it's giving you is a picture of what's happening throughout the whole cycle, and that's the difference between OvuSense and most of the other products out there. So one last thing to say is that the clinical research shows us that up to 70% of women actually have irregular timing between cycles, from one cycle to the next, in when they are actually ovulating, and this is the key to the research that we then went on to establish. So the first thing to say is, how does it compare to other products that are on the market? And as I said, largely women beyond 6 months of trying to conceive are using OvuSense, and it really sits as a good bridge between home-based testing using urine tests or other temperature methods and ultrasound in the clinic. So we've published so far 2 papers, the second of which is still embargoed, so please don't share this information outside of this group, but will be presented very shortly at the ESHRI conference in July. And those 2 papers between them identified 3 specific patterns that hadn't been seen before that we can see with the OvuSense product, and we're now going to be displaying to clinicians with the OvuSense Pro product. And these data that you can see in front of you basically identify the fact that we can show that there is a relationship between these cycle patterns and various ovulatory issues. PCOS is one that I've mentioned already. Up to 50% of women with PCOS don't get diagnosed with PCOS, even throughout their entire attempts to conceive, even if they're struggling. And that's because they simply don't present with symptoms of PCOS, so they don't tend to get tested for it. And so it's quite interesting that one of these patterns, the crash to baseline pattern, as we call it, actually identifies women with PCOS and regular cycles quite well. And the other area of particular interest is identifying risk of miscarriage. And so we married up the data in this particular study of women that had said that they had previously miscarried either 1 or more times, and obviously they had to be pregnant in order to have had a miscarriage, with these patterns. And you can see there's a very strong correlation between miscarriage and these patterns, and we hope that will lead to further research, understanding how we might be able to support women who do suffer from miscarriage, perhaps before they have to go through the pain and trauma of having miscarried 2 or 3 times in order to get treatment, as it currently is in most health systems. So that's the end of my introduction, and we can move on to the questions.
All right, excellent. Thank you so much for that introduction. I just want to have one question to our patients. Anyone else has any problems with the sound? Because I saw there are 2 patients that actually cannot hear. So please let me know, okay? Okay, you can hear. All right, I will try to help you in a bit, okay? But in the meantime, let's go to the first question that we have. Here's the question. So what is OvuSense?
Well, I've pretty much identified that already. It might be useful, perhaps, if we can quickly type an answer to that question for those that can't hear.
Yes, of course. Just let's see. Okay. I will try to see. Please check if you are using Chrome, okay? Usually that it is best to use Chrome browser, okay? And if app is not working, it's best to try to use the browser, okay? Because I see that there are only like 2 people that have problem with that. Other people can hear, right? So, okay, yeah, so possibly the app is just not working at this point when it comes to clip meetings. So apologies for that, but it seems that everything else is quite okay. So please try to use a computer or laptop. That should help, okay? Thank you.
So I've just I've just typed the answer, which is OvuSense is an app and sensor for predicting and confirming
Thank you, Rob, for
ovulation.
that.
Yeah.
All right, so let's
we
go
can move on to the next question.
Exactly. Let's go to the next question. So what's the difference between OvuSense and OvuSense Pro?
So OvuSense Pro is a device which is going to be used by clinicians, but can also be accessed by the user. It's a browser-based view of the data produced by the OvuSense app, and it will allow you to see additional analysis on the OvuSense data. So it's specifically for women that are already consulting with a clinician, be it with their GP or in fact with a fertility specialist, so that the both parties can understand more about what's happening with their cycle patterns. It identifies simple things like whether or not you've got a short luteal phase, but it will also identify these atypical patterns that I discussed earlier on in the introduction.
All right, thank you for that once again. And well, let's have a look. So why did you develop OvuSense Pro?
So this was really based on our clinical research and identification of specific problems. As I said earlier, we had a very clear set of customers that were using OvuSense who had very variable temperature in their patterns, and that variability started to take on consistency between particular women that had particular ovulatory issues. So the most obvious one, as I mentioned earlier, is polycystic ovarian syndrome. And it became very clear that a disturbed temperature pattern is very commonly associated with polycystic ovarian syndrome. It makes sense because what you're looking at with OvuSense is the level of core body temperature, and the level of core body temperature basically matches the level of progesterone in the cycle, and therefore what we're looking at when we look at a normal cycle is we're looking at a low level of temperature to begin with, a rise associated with ovulation, and then what we hope to see is that the temperature stays high. What we were noticing with women, particularly those with polycystic ovarian syndrome, is that that pattern wasn't as common, and that there was a great deal of variability in the temperature throughout the pattern itself. And that's why we characterize those specific cycle patterns. And that's why we've developed Pro to give that information in a standardized fashion to the clinician so that they can help those patients out, particularly those that have not yet received a formal diagnosis of any of these particular issues.
All right. Again, thank you so much for explaining this. And well, let's have a look. There is another question. So what is the clinical proof?
I actually demonstrated that in the final slide that I showed. We have already published 2 papers. We've just submitted a third to ASRM 2020, which will hopefully be published in October of this year, even if it's only online. And those papers, essentially, the first of them, which was presented last year, identifies the patterns that I was talking about. The second of them then relates those patterns to specific diagnoses that those patients had already had. So that's the important point about that research. Doesn't mean that that pattern means you've got a particular issue, but by relating those 2 things together, what we can do is to start to indicate to a clinician that they might want to test further for particular issues that we're finding.
Excellent. Thank you so much again for explaining this. And yes, so we did see, of course, the slide. I just want to mention that I'm really sorry that there is someone that cannot hear, but I just want to let you know that, of course, it is being recorded. Okay, so anything that you cannot hear, of course, you will be able to watch this within the next few days. Okay. And of course, let's go to the final question when it comes to those most common ones. And of course, right after that, it will be time for your questions. So don't lose your chance and simply go ahead and type those questions in. And well, the question is, so how can I get hold of OvuSense Pro?
And I can see a few people asking that already in the chat. So OvuSense Pro will be available to buy from middle of June to end of July onwards. We're currently running a beta trial of that device, and we're very happy to offer that to existing users of OvuSense for free. So they will get a 12-month subscription for OvuSense Pro. The requirement is that particular, so existing users have some form of connection currently to a clinician that they're talking to, at least, about the fertility, even if they're not in treatment or diagnosis yet, because we need to be able to connect the doctor in to this process in order to test it properly with them as well. So if you have a doctor that you're currently consulting with, basically we can send you to a page. So I'll give you a page that you can type this information into at the end, and then you can come to us basically, and we'll give you free access for a year to OvuSense Pro, as long as you have a clinician that's connected to it as well.
Excellent. Thank you so much. That sounds definitely interesting. So I'm sure that any one of you will be happy to simply use that opportunity. And well, thank you so much, Rob, for explaining all the details on OvuSense and OvuSense Pro, of course. And well, it is time for the questions from you. So let me just remind everyone that it is your chance to ask your questions. So go ahead and do it. Don't miss your chance. And there are a few questions already. So let me start with the very first one. So is OvuSense safe to use while you are pregnant?
It is safe to use, but we don't recommend use of it while you're pregnant. There are no indications for use. So I should have mentioned it's a Class 2 medical device, and that means we are heavily regulated in terms of use, and we have not tested it for use in pregnancy. Whilst there might be some value in understanding what's happening to your progesterone level in pregnancy, our indication for use doesn't essentially cover pregnancy at the moment. So we don't recommend use during pregnancy.
Of course. Thank you for your question and, of course, your help with that. So, yeah, let's have a look. There is another question already here. So how can an existing user obtain the Pro version? And what are the differences between the data available between the two versions? And what is the cost?
Okay, so the first thing is I've just given you the link to a page which should allow you to enter your email address. And hopefully, if you can identify your doctor's email address at the same time, that would be good. If not, then what we'll need is your permission to contact your doctor in some form of connection to them. And then you can get the beta trial for OvuSense. In terms of the pricing, at the moment, it's free to existing users. So the people that are online at the moment, that's fine. It'll be free for you for a year. And then when it launches, it will cost £100 extra for an annual subscription. You will be able to buy OvuSense Pro plus the current OvuSense device as a bundle if you want in the future, but that won't go live until we've gone through the beta testing.
Excellent. Thank you so much again for your question as well as your answer to that. Okay, and let me just have a look if there are any. Yeah, sorry, there is another question. So if you have normal version, would the data still be available in the Pro version?
No, you have to have Pro in order to be able to see the data. And the reason for that is, again, from a regulatory perspective, the data that we're displaying are essentially useful for the clinician. And if you're not consulting with the clinician, then in fact it's not correct in terms of our duty of care to our users to provide that data, because there's not a lot you can do with it unless you're consulting with a clinician. So you have to have Pro in order to see the data. There's a second reason, which is just a technical one. We have not put this analysis into the app because we didn't want to burden the app with more calculation. And so this is a completely separate product that is accessed via a web browser. And so you need a separate subscription from that point of view as well.
All right. Excellent. Thank you so much. That sounds interesting indeed. And also that makes sense. That's for sure. Okay. We are still waiting for some other questions. So if you have one, just go ahead and type it in. In the meantime, I would like to ask you actually, so what about the security? Yeah, because of course this is like a very delicate matter for anyone. So how can I believe that their patients will be asking, so how can I be sure that my personal data is actually protected?
Yeah, very, very good question. Well, we already have, prior to the launch of OvuSense Pro, we already had that issue, of course, because we are operating within an app environment currently. When you download your data from your sensor, nobody but you can download that data to any other version of the app. So that the sensor and the app, that's the first step in the chain. Those two things are connected, and they are connected to a single patient ID, and there's no way that anybody else can get that data. Once it's in the app, it then will essentially connect. The next time you connect to the internet, it will connect using a encrypted connection to a specific database, which we operate on a separated server using a commercial program to log those data. And the only pieces of information we retain about each customer is their email address, and if they provide it, the date of birth and how long they've been trying to conceive. We don't actually retain the name of the customer. We've just added in the fact that we need to know where you're located when you're using OvuSense. This is because there are certain data restrictions in various countries. So in Germany and the UAE, the data that you provide to a company like ourselves has to be stored under specific circumstances for those countries. So we use an encrypted methodology, and then the Pro basically uses the same database for access, but again, that is an encrypted and password protected entry into the database. And the last piece of the chain, which is very important, is it is the user that decides whether or not their clinician can connect to their data, and they do that through the app. So they have complete control over whether or not a clinician can see their data and how long for, and whether they want to stop doing that. That's under the complete control of the user.
All right. Of course. Thank you so much. And just out of curiosity, so it's like possible to also, let's say, share it with your, let's say, partner. Is it an option or not?
Correct. Not through OvuSense Pro, but through a version of the app. So and that was always a feature of the OvuSense product. So we have partners and sisters in some cases quite often do this. So they share data through the app. So each of the users has to have the app downloaded from the store. The app itself is free of charge. So in fact, it's only the active user that is paying for OvuSense, and everybody else can access the data through, again, shared through the app by the user by basically typing in the email address that they want to share with.
All right. Excellent. Thank you so much for answering that and clarifying. This is definitely important to know. Next question is up. So does the sensor work with a battery? How long does each sensor last before it has to be replaced?
So the answer is yes. We use a standard coin cell battery for the sensor. It's not recharged. Okay, so it's basically constantly in place, and each sensor has from a regulatory requirement, has a lifetime of 1 year from the point at which you start using it. So the exact time is 330 days plus 56 days to enable women with longer cycles to have a final cycle with the sensor. And then you just replace the sensor after each year of use. We sell replacement sensors at cost value. So you essentially are paying a very small amount of money to get the second sensor once you've started with OvuSense.
All right. Thank you once again for clarification to this. Well, we are still waiting for some more questions, so I encourage anyone, if you have any left, and go ahead and type it in. And when we are talking about the sensor, I just wanted to also ask, so it's like, is there like a minimum time that the sensor has to be, worn so that you have the result?
Yes, so we suggest that it should be worn for at least 6 hours a night. If you sleep for less time during the night, for instance, if you get up to go to the toilet, we recommend taking it out and then putting it back in again. So it doesn't have to be a consecutive 6-hour period. If you sleep for less time, it will sometimes be able to use that data depending on how stable it is. But essentially, 6 hours a night when you're not menstruating is the advised amount of time to use it for.
Okay, understood. Thank you so much once again. Okay, let's have a look. There is another question already, and it is: does the sensor record any data if you have less than 4 hours sleep?
So it's a similar question. Very good question. Yes. The answer is the sensor is always recording, but it cannot use the data if it is, as I said, 6 hours is the recommended amount. And generally, users, if they have less than 4 hours, it can't use that data because it can't establish an overnight temperature for those users. It's an area that we're looking to potentially improve on. We're going through an algorithm revision probably at the end of this year, and that might well mean that we can then, because we've got a large number of cycles now that we can test back over, we can probably see that most women will have a stable temperature at some point during the night that we can use. The issue is that the way that the technology works at the moment is it requires that large amount of data in order to determine an accurate temperature for that particular night.
Okay, excellent. Thank you. And there's a follow-up actually for the patient. So what happens if you need to take it out to use the toilet? Then if you wash it and put it back in, would that not mess up the reading? Example, running it under water.
So I think there's two separate parts to that question. The first thing is you can have a gap. So it doesn't have to be a consecutive 4 or 6 hours, okay, which is one thing I said earlier. If you take the sensor out, OvuSense only works on a very small temperature band. So it's ignoring all temperatures that are over 42 degrees, which is obviously way above where you'd expect it to be anyway. And that's degrees Celsius, obviously. And it's ignoring all temperatures below 36 degrees. So it just throws them away. And because it's throwing them away, it doesn't matter at all if you take out the sensor and wash it. If you wash it under cold water, it'll probably go back down to, 15 degrees in that amount of time. No problem, because it's ignoring all that data. And if you wash it under hot water, it might go up to, 45, 50 degrees even. But that's going to also get ignored in terms of data. So it's always had this intelligent filtering system to enable it to check whether or not a temperature looks like it's real, i.e. it's physiological, and it represents something that's going on within the body. So it throws away that data.
Okay, excellent to know that as well, indeed. And someone is typing, so let's give it a minute and take a look at the next question. Well, in the meantime, if you could tell us, where can you get that app? Of course, it's possible, but where is it available?
So we sell direct on OvuSense.com. So I'm just putting that up.
Perfect.
And wherever it geolocates wherever you're located. It will work out which of the sites that you should go to. So if you're located in the US, it will go to the US site. If you're located in the UK site, and so on. So OvuSense.com. You will also notice if you Google it that it's available at the moment in the United States in Amazon. We will shortly start selling in Amazon in the UK as well. But in fact, there's no benefit to buying it off Amazon. You get more choice in buying it from us, and there's no discount offers on Amazon. But we simply do that because some people want it delivered next day, and we don't currently deliver next day. Certainly not in the States.
Okay, excellent. Thank you once again for confirming that and clarifying this. And someone is again typing, so I just want to make sure we have answered all the questions. We will be slowly finishing, so I encourage anyone, if you have any questions, this is your time to do so. And there are still some questions.
Yeah, very good question.
Excellent. So can you still... let me just read it, okay, for everyone. Sure. Can you still insert the sensor after intercourse? It wouldn't interfere with any sperm or anything. Or if you have inserted a pessary, if you use it during luteal phase temperature tracking.
Yeah, so these are two very different things. So the first question, yes, no problem. No problem inserting after intercourse. Again, we obviously recommend washing the sensor in between taking it out and putting it back in again. There's no issue with inserting it after intercourse. In terms of luteal phase temperature tracking, if you've inserted a pessary, if it's a progesterone pessary, which is where I presume the question comes from, if you were inserting it around the time at which you expected to ovulate, then there is a chance that you will get a false positive caused by the rise in temperature that's caused by the artificial progesterone that is being put into the body. Most regimes for progesterone supplementation using pessaries, you generally have the progesterone provided after you ovulate, in which case that's not a problem at all because you've already gone through the process of understanding ovulation. And if you think about it, if you're taking progesterone pessary for supplementation after you've ovulated, then you want that progesterone to stay high. And if that's an artificial process, then that's fine because you want progesterone to stay high.
All right. Thank you once again for answering that. And again, someone is typing, so let's give it a minute to make sure that we have.
She had a follow-up question, which I think I've answered already, but that's...
Yes, after, yes, not during ovulation, but after.
Yeah.
That's true. All right, let's give it a second then, of course. And in the meantime, is there anything else you would like to add, Rob? We will be slowly finishing, so.
So this question, but it doesn't interfere with implantation during the 2 week
yes,
wait.
Sorry. It's true.
Is again, excellent question. No, it doesn't interfere with implantation because the process of implantation is taking place fairly obviously in the uterus. The device itself is placed in the vagina, but it's only being placed overnight. So you have there's no physical contact there. There's no issue there, which is not being implied by the question at all, I'm sure. But also, you're not changing the physiology of the hormonal process during implantation either. So there's no issue in terms of implantation.
And excellent. Thank you so much for your questions, of course, as well as your assistance with it and explaining all the details on how everything works. Okay, and there's a thank you. Okay, great. Thanks. Very helpful.
A pleasure.
Okay, and it's another follow-up. I mean, it's a great tool. Couldn't agree more. Definitely helpful. I mean, lots of women can easily use it and simply feel a bit more comfortable. I would say that it's possible to simply track it that way. Yeah. So I'm just checking if there's any other question. If not, as I mentioned, we will be slowly finishing. But as someone is typing, I just want to make sure.
That's me typing. And what I'm doing is giving you. So if you want at any point to ask any further questions, either this particular person that's asking questions or anybody else, we have online support that's 24 hours a day. And essentially that email address will get you to a form that you can fill out that will allow us to answer your questions directly. So if you have any more questions at all, that's where you go.
Excellent. That sounds definitely interesting. So exactly. So thank you so much, everyone, for joining us tonight, for your questions, but also, Rob, thank you for, again, joining our initiative, being our ambassador and supporting us as well. And thank you so much for presenting this definitely interesting tool and explaining how everything works, and of course answering all the patients' questions.
Thank you for the very interesting questions. Very, very useful.
Definitely. So huge thank you for that. And we will be finishing. So again, I just want to encourage everyone, if you would like to get in touch with Rob and his team, of course, and you have any additional questions, as Rob said, you can use the link. You can see it in the chat section right here. And of course, I just can only encourage you to join our second event tonight. As you know, we will be back here at 8 p.m. UK time. So I hope you can join us and we will have another topic to discuss. And also let me remind you that this has been recorded. So if I know some of you did have problems with hearing, so when it comes to this, so I want to just simply let you know that, of course, it has been recorded. Therefore, you will have a chance to watch this again and find out, okay? And I can only also encourage you to follow us on our YouTube channel or Facebook or Instagram, and you will be updated when the new events are coming. And there are plenty more coming soon as well. Thank you, Rob, once again. It has been a pleasure to have you here.
Thank you.
Thank you. Take care and have a lovely evening, everyone. Bye.